Hello, everyone. Welcome back to another episode of Senior Living Today. With me today is Samantha Loy, Corporate Director for the Ohio Masonic Communities Resource Center, and Melissa Todd, Corporate Sales Manager for the Ohio Masonic Communities. Ladies, thank you both for joining me today.
Thanks so much for having us back, and welcome, Samantha.
And Sam, since it is your first time on our podcast, would you mind telling our listeners a little bit about yourself and the work that you do with the Resource Center?
Yes, thank you. It's a pleasure to be here. I have been with the Ohio Masonic Communities for about 10 years. I assist the team as well as serve clients and our community members in Northeast Ohio. Prior to coming to the Ohio Masonic Communities, I served people in need through Lutheran Social Services of Northern Ohio. My background includes experience in the healthcare industry, community and social services, and just in helping people. That's what I like to do. I obtained my undergraduate degree and am working on my MBA in healthcare management through Ashland University. I am also an Ohio Eastern Star member of Ashland Chapter 92.
Once again, thank you both for joining us. And today we're going to talk a little bit about, obviously we have senior living communities across the state of Ohio, but there are times where somebody might not be quite ready to move to a senior living community, or that might not be the right choice for them. So we're going to discuss some of those other options today. To start, Melissa, I think something that you've probably heard a lot is I'm not ready to move yet. Being in sales for senior living, I'm sure that's something that comes up. So what are your first thoughts when you hear that statement?
Yes, you are right with that. It's a very common barrier or deflection comment, that we hear from the sales standpoint. And I'm also sure from Samantha's standpoint in the home, I'm not ready is very common. And the first thing that I kind of think when someone says that statement is to myself, what does ready look like? Because ready is really a context and a combination of different factors. It's the amount of education they've received on a certain situation. It is a big part of a psychology concept. Are they mentally ready to do this, or are there still some barriers that they haven't come to terms with? Is there physical readiness involved? What's their current location, and how does that make them ready or not make them ready to consider moving to a senior living community? But then we also have to talk about being prepared. Do they feel prepared to move? And is that the real barrier? But we really have to take a step back and kind of dissect what someone being ready looks like and why they're not currently ready, to see if we can help them get to that point. And I know in the past, I've worked with Samantha on many families who weren't there just yet. And we were able to collaborate and bring in some interventions and some different support tools that she's more keen to hopefully in the future make them be that ready person and willing to move in.
Moving is a very overwhelming thought. And just like Melissa said, getting to that point, it can take time. And so we're both here to help through the Resource Center and through our campuses to help through that journey with each step along the way.
And Sam, can you give us just a little overview of the Resource Center and the types of services that you do provide to clients, and how you can kind of be that stepping stone for families when they're not quite ready to make the move yet?
Absolutely. Well, first, just a little bit about the Resource Center. We do have an intake coordinator, but then we have 6 community outreach coordinators that are located throughout the state. And so we can help clients financially, socially, and clinically if they are a Mason, wife or widow of a Mason, an Eastern Star, or even a non-Mason. We provide home visits to better assess our clients' needs. And so part of that, if someone was interested in maybe moving to a campus, we would go out, do a home visit, just sit down and talk with them, try to find out, what's their timeline? What are they looking at? When would they think that it would be feasible to move. And then also looking at, the size of their house, the size of the apartment they'd be moving into, what they might want to take with them. and helping to set up moving companies or even getting some in-home help to pack boxes. There's just a lot of different ways in which we could help to coordinate that move. And, it might be something that takes time, and as it does. So we can help whether they need to move in 2 weeks or 6 months.
So something else that we hear from families, maybe when they're not ready to move into a community or move their loved one to a community, is that they're interested in home health or home care services. So is the Resource Center able to connect families with those resources in their communities, or how does that process work when you get that type of a request, Samantha?
Yes, we can absolutely help with making referrals for in-home care. It could be for non-skilled needs if somebody needs help with light housekeeping, transportation, things like that. Or it could also be for home health care if they need assistance with medication monitoring and assistance, or any help with their activities of daily living. So we can help to make those referrals and coordinate services.
And then, so another thing you brought up was transportation. We know that's something that sometimes people need assistance with getting to their doctor's appointments. I know that the Resource Center has also done some work with making the home that they live in a little bit more accessible and friendly for any challenges that they might have. So can you talk a little bit about that and some of the work that your volunteers do?
Absolutely. And this can be something that home care providers may be able to help with as well. If a client has a schedule of medical appointments or transportation needs, but we can also reach out to our volunteer base, which includes over 350 volunteers throughout the state. And they may also be able to help with those transportation needs. And that means a lot, especially, if someone is requesting another Mason to take them, we can help with that.
And speaking of volunteers, anybody who's listening right now who might be interested in volunteering with the Resource Center, do you accept new volunteers, and how might somebody go about that process if they'd be interested in volunteering with us?
Absolutely. We would love to have new volunteers. If anyone is interested in volunteering, we have a very easy application process that we can walk you through. Just call us at our 877 number, which we will provide details with at the end of this. Or you can also reach out to us through our website. There's a contact us page with more information on our volunteer program.
So Melissa, let's now move to a topic that I'm sure you're quite familiar with, and that's respite care. So this can be another great option for families and their loved ones who aren't ready to make that final move to a senior community or that final decision yet. So can you give us an overview of what respite care is, how somebody might go about finding that in their community, and who it might be right for?
I can. Yes, respite care is definitely in my bag of tricks. I use it most commonly in a few different situations. Someone who is not ready and maybe fearful of making a permanent commitment. Respite is a short-term stay. So it's almost like a trial, and it can be proposed to the resident, the family member, or anyone that's involved in this decision making as a temporary try before you buy type setting. Come in, come stay with us, experience what a week, 2 weeks, or a month looks like living on the campus, and then make your decision. So we really do use it in our bag of tricks, kind of lets that barrier down for someone who, doesn't want to sign this permanent commitment, even though our commitments aren't as permanent as they think. It's that mental and emotional barrier that we're able to ease them into this. We also see a lot of respite care solutions when family is providing the direct support or care for their loved one, and maybe they need to go on vacation, or they have a daughter getting married, or we just recently had a respite stay occur at one of our campuses because the family was going college hunting for their daughter. So this staycation respite was a great solution for those families because they had the peace of mind that they could step away, do their vacation, do their task that was out of town, out of state for a set number of days, and their loved one just visited and also did a vacation with us in the safety of, one of our communities. So those are two probably most popular reasons respite could be a good solution for someone. And I've heard every other reason under the book to do a respite, including home maintenance and repairs, but also as a step down solution. If someone's not truly ready to go home, they can come and do a respite stay just to be sure that they're prepared for their home environment again.
And Melissa, you brought up a great point for those who are caring for their loved ones at home. And there are times they need a break or life happens and things come up and they need other solutions. So I think respite care is a great solution, but another option would be an adult daycare type situation. So Sam, is this something that you've ever helped families with? Is this something that the Resource Center can help connect families to in their local community?
Absolutely. Actually, we've had a lot of calls come in lately for adult daycare and just respite information. So one of the things that we do is to help coordinate those services and help provide a list of resources for locations that offer either adult daycare or longer term respite care. So many adult daycare centers also offer transportation, which is also very nice. So all of our coordinators across the state have those lists of providers that offer these services. So we are happy to make those connections.
Lastly, we're going to talk about senior living communities as an option. Melissa, I know that there are times when home health or other in-home programs just might no longer work for families, and it could be time to actually look at making the move to a senior living community. So what are some of the different options available for families to consider, and what are the benefits of moving their loved one to a senior living community?
The overall benefit is this peace of mind, and it's not only for the family that might be involved, but I promise there is a positive entity that comes with a move as long as someone is ready and in that right mindset. So whether they're looking, at independent living and benefiting from the social aspects of that experience, or if they've moved into more of a clinical need care area where we're considering assisted living, those are all great options that we have at our communities. There's also the fine line, when someone might be physically mobile, but mentally there's some deterioration. And our communities offer a memory care support neighborhood. So we have all these solutions. We just really need to work with the families to kind of fine tune what their expectation is for a move. Have we plugged in all the other external interventions? That way, when they're ready, they feel even more confident in the move and in the decision. And they're kind of more open to experiencing this different lifestyle on campus that, involves a good routine, that involves daily interaction with not only our staff, but other peers that are their same age. And I just love tracking the progress that someone makes from their first day moving on to campus, all the way to the 60-day mark and the 90-day mark. There really is a lot of growth that can be seen. And it's really nice when the families come full circle and get to share the fact that their loved one has been with us for X amount of days and what an improvement in the conversations that they're having. And sometimes even in the accessibility of their loved one, we get that a lot. I've called my mom 6 times today and she was out and about. I couldn't catch her. When I did catch her, she had to let me go quick because she had to be somewhere. And those are all the success stories that Samantha and I really get to hear when we have a successful move into campus.
Well, Samantha, before we close today, would you mind telling us how families as well as potential volunteers can get in touch with the Resource Center?
Absolutely. We have a toll-free line. Anyone can call 1-877-881-1623, or you can also contact us via our website through www.omcresourcecenter.org.
Thank you, Sam. And for our listeners, we'll be sure to put that information in the description for this episode as well. So thank you both again for joining me. It was so great having you here with us today, and you shared so much helpful information for our listeners. So thank you. For all of our listeners, be sure to tune into our next podcast in 2 weeks. We will be discussing Medicare, Medicaid, as well as long-term care insurance. As always, be sure to like and subscribe so you never miss a new episode, and we will be back again in 2 weeks.